discussion. It's welcome to the National Action Agenda to Advance Upstream Social Determinants and Rights Equity. And I am so thrilled and delighted to be here today speaking with you and welcoming you to the first session of this ambitious project that we've now begun to embark on. There's a little trepidation and anxiety as well. We have a lot of experience doing these kinds of things in person, and of course, doing it online is a different situation altogether. So I hope that this works out great. I have to say, first of all, thank you for everyone who's on the line and everyone who's joined this initiative. It's been an amazingly, really enthusiastic response we've gotten to the call for participation, and the participation is just has been overwhelmingly positive, and people stepping forward and wanting to do this work. So that is great. We will be recording this session, and that will be available to everyone after we get done. The agenda for today, I'm going to go through this very quickly. I think you've seen this before. It's pretty simple. There's sort of three parts to it. One is the first session here, where we'll do some introductions, welcoming and invocation, acknowledgements, and give a little bit of background, and then kind of review the goals and approach and some of the activities that you will be participating in both later this afternoon and as we go forward. We'll then take a break from 2 to 2:25, and then we'll come back and we'll break into the work groups that all of you should have been signed up for as we go forward. And Mike Kerr, who's on the phone here, will be moving everybody into those groups. And so when we do get back, we'll all come back together, and then we'll break into the groups. And I think you've all seen some of the correspondence with the with our liaisons and the co-hosts. So we'll describe that process a little bit more as we go forward. In the unlikely event that there is some kind of technical glitch, the thing to do is just to dial back into the Zoom number is the first choice. If for some reason Zoom decides to implode today, we do have an alternative, which is on an Uber line, different Uber than car Uber. There's a phone line and a screen sharing as well. That's highly unlikely, but we will sort of use that, and you'll receive an email from Grace Core should that actually need to happen. Mike, there's some little bit of background noise here, so if you can just find the whoever's not muted, that would be great. So that's the agenda for today, and I'm sure it'll go quickly as we step forward. So with that, I would like to sort of provide a little context for the conversation we're going to be having here this afternoon. In February, we began to plan our 14th annual symposium, and we were delighted to be starting to plan that with our colleagues at Stanford Center for Population Health Sciences. And then COVID arrived, and we realized that we really needed to do something different. As February and March started happening, it became obvious to us, and particularly some of us being in the New York area, just the scale and the scope of the change. And having never lived through a pandemic before, it became clear that this was different than other things. This is described in exponential terms. And I think that that's something that is incredibly new and different for us and for the American people to recognize that things don't grow linearly, but they grow exponentially. And so as we looked at this and we talked about it, we thought about what could we be doing to address that? And ideally, what could we do as a community writ large to address that issue, address the issues as they were beginning to mount? It's clear that there are, at that point in time, and now certainly now, the downstream impact of the pandemic are enormous. They're yet not known. but they're on par with something of the nature of the 1918 pandemic or the Depression or the World War II D-Day or 9/11 for that matter. And as I'm reminded by Thomas Kuhn, who wrote The Structure of Scientific Revolutions back in 1962, which I'm sure everyone read in undergraduate. I remember having a discussion about it in 1975, coining the term sort of a paradigm change, and that's become part of our lexicon over the years. While people have talked about that, this is certainly a paradigm change to a degree, a profound degree that we haven't really experienced before in our lifetimes. And so that is having a tremendous impact on so many areas of our lives and our economy and culture and all those things, and in particular, our safety net programs. Our safety net programs are being stretched to the hilt today. And we expect that in the future that they will become even more stretched as budgets get cut and the demand for services get increased. So that really in many ways underscored our desire to think big, think bold, think audaciously, think consequentially, and system level change. The time for incremental change is past, and that really became the motivation for this national action agenda. And could we, in fact, as a group, identify a few things that would be substantial, that could actually have a structural impact, a structural change on the systems that we're operating under and within? And if we think about the size of the economy, and we think about the size of the health and human services economy, reaching probably somewhere between $5 and $6 trillion. That's a significant part of our economy. If we could have even a small impact, even a 1% or 1/10 of 1%, yield tremendous, tremendous benefits that could be redeployed for services and improvement and innovation. It is not without consideration that this is in fact audacious, and that to do something of this scale or of scale, while it is important, it is also critical that we think about doing it in a way that is just, that guarantees equity, is not creating more harm, and that we think about how to do that in an ethical, responsible, secure way. And that we do need to proceed boldly, but we also need to do it carefully and responsibly. And I'm reminded of the phrase, if not now, then when? And then if not us, whom will take that mantle upon us? And so I think that as we move forward in this, we do want to go far, and we want to go far together, but we also want to go fast. So the way to do that is through community and not through individual action. Of course, individual action is important, but through community and through collaboration, I think we have an opportunity to make significant change as we go forward. And I'm so encouraged by the people on this call and the people who've responded so positively to this mission and this call for action. Again, almost becoming a hackneyed phrase of skating to where the puck is. I don't know if it is better explained anywhere else. That is also part of the thinking here, is that our plans that we're developing, our thinking is not relevant. While it's relevant today, it's not going to necessarily be relevant in January, February, or March. So we need to be thinking about where it's going so that the changes that we're recommending, the actionable changes, are in fact appropriate for the time and the moment when we get there. This is not a field of dreams exercise. This is not a build it and they will come. This is a build it together. So when we get there, we will be together and we'll be able to take action that's meaningfully grounded and based in the best knowledge and learning of people who are deeply, deeply entrenched in these areas and deeply knowledgeable along the way. This will be an emergent process. It will be agile. It will be iterative. It will be what we make it as individuals and as teams, there is not a grand plan. There is a process that we've set out. There is a context, a form, a container, and tools to work with. And we've set those up, and you've seen some of them, and we'll describe more of them as we go forward. But in other words, we've sent out the invitations, we've shopped for the ingredients, we've prepared the meal, we've set the table, lit the candles, and now we're anxiously awaiting your presence. And so with that, today is really the first course of this longer term meal that's being served. And we and I and our team really looks forward to what this turns out to be, what we make of it as we go forward, and what the potentials of being successful will look like. And with that, I would like to invite two speakers to speak today briefly. And the first person is Beverly Walker, who's a Stewards of Change board member. She joined Stewards of Change about 1.5 years, 2 years ago. A little background noise, Mike, if you could mute someone. And if somebody, I'm pretty sure I saw Beverly online. Is she online? Beverly, are you here?
I am here.
Okay, great. So just a little bit of background. So Beverly has gracefully agreed to join our board. And she brought to the table a request to address issues of social and racial equity as a participation on the board. It was incredibly relevant then. It is even more critical now as we think about speaking truth to power and recognizing the challenges. And as I said, not to do harm as we go forward. And that is something I know that Beverly has pursued along the way of her long and stellar career of over 40 years being a change agent in education and human services, working in Georgia and Illinois in human services and child welfare and public health, mental health. She worked for Richard Daley as chief of staff and leading significant human services and educational initiatives. Following that, working at Deloitte, and now runs Public Way Consultancy to support change management on scale. And I'm going to introduce Dave right now as well, so we can just sort of transition over. Dave Ross, who's on the phone, had the great pleasure of meeting Dave a number of years ago on a tour with the Robert Johnson Foundation on Data for Health at the beginning of the Culture of Health work. Dave is currently head of the Task Force for Global Health, Gates Initiative, one of the largest, I believe, and the former director of the Public Health Informatics Institute, a leader in the field of public health informatics. His career has included aerospace and healthcare, public health research, and more recently, global health in particular. He's a recipient of the Hilton Humanitarian Prize for Humanitarian Work. And that's quite significant. Dave has built an incredible reputation and has been able to work at scale on a national and a global level to eliminate disease and build community across the world through the task force, having treated over 350 million individuals with over 2 billion treatments. I asked Dave to speak today because he has a system level view of the possibility of change that is unique and rare. And not only a view, but the experience to actually having done it. And it's been an inspiration for me to think big, to think bold, to think audaciously, and importantly, the power of collaboration to make change through groups, through people, through coalitions. And so I invite Dave and Beverly to address us now and to help us kick off this meaningful experience. Beverly?
So call me BJ, please.
Okay.
People call me that. I want to underscore Daniel's intro around the times we are living in. Certainly the pandemic is one context, but we are also experiencing a tidal wave of conversation and action about racial justice. And I guess my invocation piece today is to implore us to look at our work through this lens, and whatever work we do these days, I think has to pledge allegiance to that conversation and those actions that are happening every day around us, and then do something different because of it. I hesitated to say this, but I need to say it. I know that much of our conversation today is going to be about all lives, and we all, and the assumption that all lives matter, and they absolutely do. But we must face the fact that in this nation for too long, some lives simply have not mattered. And we have to pledge allegiance to making them matter. I've worked with public systems. Daniel said 40 years. Okay, so I'll own those. I've been a Black woman, a mother, a grandmother, and I'm a great grandmother. The one thing, though, I have never lost sight of is that poor people in this country, and particularly poor people of color, lead complicated lives. And we need to stop and ask ourselves, why do we keep inventing and reinventing how we serve poor people, the systems that we build to serve them, and we turn around and look and they're still poor? And I don't believe that's a question of what we know or don't know about individual people. It's a question, as Daniel said in his overview, about systems and about why they keep failing to build the safety net that is really, really safe. As we start this work again around integrating systems and sharing data about what we need to know and when and why we need to know it about people's lives, we must remember that we've been here before. I know I've been here before. And each time when I sat at the table around this task, I see us getting the same result. When we worked on it, we got lost in the transactions. We beat our heads against the wall trying unsuccessfully to solve legal, technical, and policy issues. But in the process, we have failed to have a moral compass. I implore us working on this issue this time once again, it's time to lift up racial justice. We must own it at the heart of the work. I urge us this time to not get so distracted by the transactions associated with interoperability and integrated data systems that we forget transactions are simply the steps we take and the tools we use to fix problems as they present themselves in the delivery of public programs. To get the job done this time, we need to be transformational, because transformation is what will be needed to change the environment within which these transactions take place. And that is how we will ultimately build the kinds of systems that have the capacity to fix people's lives. To truly be honest about how racism is affecting people of color and the health and human services system serving them in this country, we must realize that the disparities and the inequities we see are not individual and personal. They are structural, and they are rooted in things we find it hard to talk about: racism, bigotry, privilege, persistent and pre-existing notions about who people are and why they find themselves in the situation they are in. We therefore often ignore the structural impediments in our social fabric that are producing the problems we see in people who are served by health and human services. We forget to see the lack of educational opportunity, the lack of equal access to healthcare, to housing, to employment, heck, to groceries. In delivering social services, we step over the people because they are complicated and hard. And we too often focus on fixing the transactions because they're easier And we think we are going to do something to serve folks better if they get fixed. We must face the fact that that isn't going to happen by itself. We often forget to really understand fully how the data we see about people and want so desperately to integrate is really a reflection of the environment that those folks are living in. An environment that has been unfriendly and harsh and unsupportive of their rights to life, liberty, and the pursuit of happiness. Ladies and gentlemen, in this nation, we are not all having the same experience. And our public systems reflect not the lives of those they are designed to serve, but of those whose life experiences can most easily overlook racism and exclusion because they're not affected by it. I realize we all know that simply knowing more about individual people will not improve their fate, but I am not sure we all understand how it might and does reinforce and seal that fate. Let me talk by example. The free and reduced lunch program in this country integrates data about families, and it then allows schools and kids to be defined by a set of social and economic deficiencies. But instead of that giving us a program that promotes racial and social justice, we get a program that targets kids as deficient. It shows up not just when they get their lunch tray, it shows up when they get seen by the school guidance counselor who perhaps pushes them in line for vocational training rather than plotting out their path to Harvard or Stanford. It shows up in a school that no one, even those who live in the neighborhood of the school, wants to attend. Because if you go there, everyone knows that means you are not smart enough and your family is not good enough to get you in a so-called school of choice. As we pursue our work, we need to worry about the inadvertent ways in which our systems and data help us illuminate in people's lives the very conditions we are trying to change. Until and unless we are willing to take on the task of reforming these very systems themselves and the society which for far too long has accepted them and promoted them, because after all, people do get some services and programs, but we need to ask, but to what end? What do I therefore recommend? I like to bring good news with my bad news. We need to be intentionally proactive about helping people understand that solving the data access and the integration problem from government is not addressing how the people we serve got here and got at the doors of these systems. We need to use data to help people stop seeing families, like the Thompson family example, so much through the lens of their poverty and deprivation that we do not see them through the lens of how historically this nation and its systems have underserved them and therefore set them up for the picture that the data presents. After all, we only know what the data says, not what these people say about themselves. We need to use the data we do have to make recommendations that dismantle our current systems and rebuild them. We do not need the current systems to just have better access and more data. We need them to have a different purpose and intent. And we need to lead with a conversation about what the business need is for knowing and sharing data about people. What do we need to know and why do we need to know it? Not just what can we know? And ask the people whose data this is to be part of that conversation and decision. I feel inspired that we can do a different thing this time, but I implore myself and all the rest of us in the work to think differently and through the lens of racial and social justice as the purpose of our work and the context within which people's lives are impacted as the environment in which we want to do the work. Thank you. I appreciate it, and I really look forward to working with you.
Applause would be appropriate now. Thank you so much.
Absolutely.
It was well said. Well said. Thank you so much, BJ, for saying that. I think we can all just take a moment, breathe.
I gotta breathe.
You need to do a little breathing over there yourself.
I can breathe myself now.
You can see the comments are really in support of what you're saying. That's great to hear that. Keep the comments and cards coming. I hope that the program and the thoughts that we've put together are in alignment with that, and I will look to you and all of the other people on this call to make sure that we keep this front and center on this idea of who we're serving and for what purpose, and to listen to them as well. And I know we can always do more and always do better with that. So thank you, and I look forward to your participation as we go through this today and into the future. With that, I'd like to hand it back to Dave, or hand it over to Dave. I know it's a hard act to follow, as they say.
Yeah.
But thank you for your words of what you're going to say to us.
Thanks. Yeah, hello everybody. Thank you, BJ. Very, very inspiring and absolutely spot on right. You know, as you were speaking, it made me realize why the plaque that we have in the lobby of one of our buildings is a quote from our founder, Dr. Bill Faggy, that says, "Behind the number are faces. Never forget to see the faces." And you just pointed that out. This is really about endorsing and acknowledging everyone's humanity and caring about people. It's not just about making data flow from one set of activities to another efficiently. You know, this point was sort of driven home to me, as Daniel said. He and I met a few years back when we were on this RWJ national initiative together called Data for Health. What we did was we visited cities across the country and met with multiple sectors all around the idea of social determinants of health. And in every one of these meetings in every city were people from healthcare and public health, the business sector, transportation, education, social services, everybody. And every one of these visits, we all came to the same conclusion, and that was that there was this overarching need to bring people together, and that we could and should be learning from one another and actually understand the interconnectedness of us if we're going to actually help people. So there was this sort of aha. And then I think back in the mid-2000s, and sort of as I was thinking about the work of this group, and today I remembered a project we did with the Santa Cruz, California Health Department back in the mid-2000s under another information initiative funded by RWJ, where the health officer there had one specific problem she wanted to address, and that was childhood overweight and childhood obesity. And the way we went about working to solve that was literally bringing all the partners together, all the people who actually had a stake at this, of fixing and solving this problem, addressing the problem. So she brought together people from medical care, the pediatricians. She brought together the Parks and Recreation people, the education people, the transportation people, and even the fast food people, as well as her public health staff and data people. The net result of those discussions was the collective aha of all these people, that each wanted information from the other, but none had stopped to recognize they had an obligation to work with the other partners, because they could they could pass on useful help, information, assistance to the others. So as much as this was framed as a data project, what it really was a community coming together to say, we have a problem. We all care about solving that problem because it is consequential in people's lives. In this particular community, it was largely centered around a low-income Hispanic population. But it meant all parties had to join together to understand this was a collective problem. So, you know, Daniel asked me to talk today a bit about from the global perspective. So this task of systems operability at times sounds simple, and other times just unattainable. But I think we come together to take this next step of having programmatic activity work together and help to the purposes that BJ spoke to. And this is the kind of stuff, if you hand it off to the technologists and engineers, the big meaning of the work we do gets lost. So this is where all of you really play an instrumental role. From my global perspective, you know, I live in a world where we're talking about disease containment, disease elimination, disease prevention. My founding director, Dr. Bill Faggy, very well-known person in the world of global health, he really brought clarity to the big mission by simply noting that there are a few indicators that tell us whether or not the massive goal of the global health investment is having its desired impact. All we have to do is track child mortality and poverty. And if these numbers are not moving in the right direction over time, then the investment in its aggregate is failing. So we have collectively often a failed investment problem. And we need to see it as such, but we need to have measures that help us know whether we are in fact making any progress. And we have to be joined together enough and willing to call out when we're failing. So in global health, all these programs are certainly well-intended. We've got hundreds of them, and each has had significant success over the years. There is, however, I think, a major gotcha, and that is that many of these programs will ultimately fail to produce lasting health impact if the countries in which they operate fail to build health systems. And I would stress the word system. A system is that can maintain the health gains that we've brought about through and because of these single focus health programs. So, you know, looking at this, how does this world of global health and diseases help us think about confronting our mission today? I think simply put, the solution is that lasting health impact globally resides in building shared understanding of the nature of the systems that we must build, and in appreciating the impact on health that's required by building sustainable systems. Sustainable systems to me means that they must usefully inform the stakeholders to have lasting economic value. So questions that you're asking today, like what do you need to know about the clients? And what do you need to know from or about the systems of care or service that your clients interact with? And what are the significant gaps between client needs and systems of service? I think these are the right questions, and this is the right starting point. At the Task Force for Global Health, we've learned that the path to success rests in building these collaborative partnerships. And they, if done well, they succeed in helping all the partners share a common view of the problem. Unless we all know the problem we're solving, we can't solve it. And in ensuring that each of the partners' essential information needs are met. So building the bond that keeps us holding hands together, in effect, to say we are working to solve this problem and we're not going to let go of it, is the important first step. We've done that on the global scale in a number of areas, and as a result, there's a handful of diseases that in the next 5 or so years are going to be eliminated essentially from the earth as problems. So it can be done. I think what we're looking at in the US is a vastly complicated challenge. But there are examples of success in the US, smaller scale, but I noticed that Dr. Noam Martz is on. Noam has played a big role in helping build the network of immunization registries throughout the states. Well, that all began 25 years ago when nobody even knew what the problem was. And then within a few years, everybody was able to agree on what the solution might look like. And then ultimately they standardized it, and ultimately every state acting independently was able to start to knit together. So work like this can be quite successful. But I do think it starts by remembering that we must see the faces, as BJ said, and the purpose. I'm really, really glad to hear you talk about racial equity and racial justice. Yes, this is, I hope, a pivot time in our nation's history. I won't try to wander too politically here, but things have to change, things have to get better. And I think Bill Feige's advice and admonition to always see the faces is one way we can keep in mind and make progress. So Daniel, with that, I turn back to you. Thanks.
Thank you, Dave. I appreciate that. It's hard to do justice to the experience of both of you in such a short period of time, but I appreciate it. And I hope that as we go through this process and over the years, we'll hear more from you as we go forward and draw from your wisdom and your expertise and your efforts to keep us on track. So with that, let me advance here into some of the people. We have had an extraordinary outflowing of interest and support. I'm just going to spend a few slides kind of sharing who's involved a little bit. You probably have already seen the list of participants, but I think it's important to show who it is that is helping us get there. As I said, we're building this together, and we're building it collaboratively so that we can really arrive at the place we want to collectively. Without our sponsors, we wouldn't be able to be here. And so I want to call out our sponsors and our partners in this effort. And in these times, these very tough economic times, it is a challenge to ask both corporations and foundations for things that are strategic, somewhat longer term, and not helping people's immediate needs. But folks have stepped forward. And it's gratifying and incredibly supportive to know that. And our work has also been very much enabled by the Kresge Foundation over the last several years to build out a national collaborative that has been in many ways the foundation to the work that we are doing. And so thank you all greatly. I'll just put a plug in. If others are wanting to join the sponsor work, by all means, we would love to talk with you. So I want to just spend a few minutes now with and ask our project leadership team just to say hello, introduce yourselves. Without David and Karen, PG, and our team from Adam and Gillian from the stewards team, I would just like for you to hear their voice a bit around kind of how they're coming at it. All incredibly experienced, knowledgeable partners, and have been incredibly helpful as we've gone into this process. So David, why don't you start it off here for us?
Thank you, Daniel. Thank you, everyone, for being here today. We're so glad to be starting this process. We know how much time it is, and we appreciate all your investment in time today and going forward to really, go and attack these and address these things that both BJ and Dave talked about today. I couldn't agree more with all of that. As we were thinking about RBG this last week and hearing her talk about, our failure to live up to the ideals of life, liberty, and the pursuit of happiness, like BJ talked about, we have a long way to go. And I think keeping that front and center about what we can do. I'm a social epidemiologist here at Stanford. For those of you who don't know me, I'm co-director for the Stanford Center for Population Health Sciences. And the reason we're involved, the reason we're co-sponsoring this with Stewards of Change is exactly along the lines of what BJ talked about. We're academics, we do academic work, we look at data, we think about evaluating things, but we fully realize that this can only happen by connecting with people, connecting with communities, hearing the real stories, really thinking about what people need. So that's really our goal here, to reach into that space and listen and see how we can be a resource for moving things forward. So thank you again, everyone, for being here, and BJ and David, both for your really inspiring and thoughtful remarks to open this up today.
Thanks, David. It's great to have your partnership and your support, as well as the rest of the Stanford team. A number of them are involved today and have been for a while. So thank you all very much for your encouragement and your openness to participate. Karen.
Hi, everybody. Thanks, Daniel. For those of you who don't know me, I've spent my entire career in governmental public health. And when Daniel and Adam came to me almost a year ago and we started talking about what can we do around social determinants of health, my one plea was, could we please just not have another large cocktail conversation about it, but actually do something that can result in action. And I am ecstatic to see how many people have signed on to actually work towards something real that can actually happen in the real world, because the problems that we are facing as a society are extreme, and they are right now more visible to more people than they will ever be again. So this is the time for this work, and I'm really grateful to everyone who's here and to Stewards of Change and Stanford and the other providers that we can actually do this in a way that I hope is really the right way, which is as a community. Thanks.
Thanks, Karen. Yes, your admonition and your challenge to take action has been really the galvanizing theme, I think, that has, I'm pretty sure, motivated the 9,600 people on the, or the 100 people on the phone here. That call for action is resonating and has been resonant when we talk with people. PG, welcome.
So good morning, PG Forrest. I'm the director of the School of Public Policy. I'm located in Calgary. It's 330 miles north of the US border. The city is famous, of course, for being the birthplace of Ted Cruz. I've been a road companion of Steward of Change now for more than 7 years, and I think it's already very evident this morning that one of the reasons I've been working with Daniel and his fabulous team for years is because I've been very impressed by this very concrete, very actionable, very evidence-based approach to questions like interoperability and of course social determinants of health. The other reason, and it's probably very important for me, given my position, I'm not American, and for me it was an opportunity to work with people that are engaged at local, at county, at state level, and therefore are as most of you are this morning, and so people that are very close to the cold face, very close to real problems, and it's for me a real source not only of information but of course of inspiration. What I'm hoping we will see at the end of this process, of course, this is my field, and it's better policies and policies that will bring, I think this is clear this morning, more equity, more inclusion, and of course that will also make life for everyone better. And so I'm very honored to be part of this long track but that I'm sure will end in a better place.
Thanks, PG. It's been great to have you on the journey from all the various different vantage points. I also want to call out Adam Pertman and also Gillian Tucker, who have been sort of co-leading this with us and have just been extraordinary in their persistence and the innovation and creativity and support for the process here. So there's many people to thank, but specifically, thank you for the work that you've done and are doing.
Can I just take 30 seconds?
Yes.
I just want to say that, and Daniel and I have talked about this, if this mission is successful, and we all wouldn't be here if we didn't think it could be, it will not be because we have a lot of smart people who will come up with a really good plan. There are a lot of really good plans created by a lot of smart people out there. This is an extraordinary gathering of people, I think, from across disciplines, across the country and some other countries. If we're successful, I think it will be because you all stuck with it, because you all came together. And when we get to January, you'll still be here and you will help us and you will be the implementers, not just the planners. And that, I think, is what distinguishes this work, that we have put together the people who can actually help make it happen and not just think about what should happen. So my 2 cents is that I could not be more grateful to be working with Daniel and Gillian and the whole team on the project like this. But more than anything, I am so heartened by the extraordinary gathering of people that you all are. And it gives me hope that we're actually going to do this thing.
Fantastic. Thanks, Adam. Gillian, do you have a word, or you want to?
I'll just say I agree. It's very exciting from the early days of having the National Interoperability Collaborative in mind to building it, and now seeing us taking action. It's, as Karen said, going beyond the conversation, but to actually be doing something that I think will just be invaluable. It's very exciting to see. So with that being said, I'm ready to get going and do the work.
Thank you. And away we go. So, of course, it's of critical importance to recognize our board of directors who, on top of their day jobs and their other multiple interests, have been quite supportive of our work and have been thoughtful leaders in helping set a direction and to encourage and challenge and direct. And I'm delighted that many of them are on the call today and will be involved with us as we go forward. An extraordinary group of people. And I want to thank you again so much for the support that you've provided and will be providing as we go into the future. So thank you. Another group of folks who many of you have interacted with are already the work group leaders and liaisons. So what we wanted to do is we wanted to set up this process so that it was a distributed process. It was not a hierarchical one. And that, so we elicited and solicited people who wanted to lead or co-lead the events, and you can see their names on here. And we've each of them are leading and facilitating the work groups that we'll be holding later this afternoon. Again, another extraordinary group of folks, and again, who all have day jobs and who are interested in and supportive of the work we're doing. There's also a Stewards of Change Institute liaison person in each of the groups. So as I said before about setting the context or setting the table, we're providing a context from which to do the work and to bring your subject matter expertise, your passion, your knowledge, all of the above. And so thank you all for the work you've done and the work you will be doing. We also have a number of advisors. I'm calling them synthesis advisors because what we wanted them to do is help us as we create these ideas, and not to leave them in a silo, not to leave them in a vertical, but to actually look at how do we look across the various different groups and look for those things that are common, that have the most potential for change and the opportunity for making at scale kinds of change. And so our advisors will be, again, many of them are participating today, and over time they will be engaged as we move further into the actual design, development, and recommendations of the work. So thank you again for all the folks who have stepped forward to be advisors on that. This next point, I'm really proud to be able to share these organizations as a community of networks. For those who have participated in some of our work over the years, I guess the years at this point in time, recognize that we use this term community of networks to describe what we're attempting to do. Every field, every discipline, every domain, every sector has their own networks. They have their own organizations, their own structures. Here, we recognize that. And what we're looking to do is, and they all have their own communities. What our goal has been is to cut across those, to step across those various segments and point out those areas that have commonalities across, whether or not it's healthcare or public health or public safety or education, human services, law. And over the course of the last number of years, we have also encountered other networks that are doing related work to us. Of course, data across sectors from our WJF, the Gravity Project, part of and connected to the Siren Initiative out of UCSF. The world of HIMSS, the universe of HIMSS, Foresight, Levitt Partners, and the Wellbeing in the Nation Network. In our conversations over the months, we've been starting to build those relationships. The point of, not to build those, but to build the interstitial tissue, because we'll get farther faster if we are able to link arms and recognize that there's common work happening across many of these different initiatives, very scaled kinds of initiatives. And so I'm delighted to report and to say that there is this growing network, so that the work we do will potentially be amplified, disseminated, and supported outside of this network and connected to many others, and others that are not on this list here. And that's, I think, that opportunity for leverage is quite enormous and quite positive. So I'm delighted and excited about being able to display and describe that. So a little bit of history here. So Stewards has been around for about 15 years, and our whole purpose has been to cross sectors and domains. And that's the work we've been doing and have continued to pursue that in the context of, in fact, what we're talking about today. And what we will be talking about. How do we do more of that transformational change between and across systems, as well as within systems? Those are hugely important. The NIC, or the National Interoperability Collaborative, is also an outgrowth. It's a project of Stewards of Change. It's not its own entity. It's a project. And we were able to stand that up with support from Kresge Foundation and other foundations and corporate sponsors over the last number of years to do that, to fulfill that mission of cutting across the domains, of bringing people together with common interests, and hopefully to reduce some of the duplication and to learn from one another. So it has been built. There's a version out of it. Many of you have already joined to become members. We hope the rest of you will join. Over the last year, we've conducted over 50 webinars, bringing people in from all sorts of different communities and networks. And the purpose of that was to educate across the domains, and also to create the network to be able to do more of this work as we go forward. And so those are the entities that are really in many ways supporting the work. Briefly, and you can read this quickly, is interoperability. Sometimes we use that word and not everybody has the same terminology. And just very quickly, it's historically been associated with technical connectivity and engineering. We use it in the broader social, legal, political, organizational context of being able to share information, being able to interoperate between folks and between organizations, set the terms. And upstream has become also very current lately. We think about that in terms of prevention, recognizing that if we can get a little bit further upstream in this work, maybe we can prevent. Maybe we can actually ameliorate the situation or provide the kinds of support for the people who need it at that moment, as opposed to the downstream effects of it. And so I think that's a powerful, important concept. And that's part of the focus of what we're talking about here, is looking at the upstream preventive parts of the work that we're doing here. So I wanted to just set those definitional contexts as we go forward. So what do we plan to accomplish? Well, our goal is to improve the health, safety, well-being, and equity, especially by addressing racial justice and socioeconomic disparities for underserved and under-resourced populations. Second, how are we going to do that? We want to focus on improving upstream social influences by dramatically improving responsible information sharing and interoperability across domains. And I use the word responsibly importantly here, and quite intentionally, as well as the word dramatically. And finally, our deliverables here. I think the success of this program will be to identify literally a small number of high value, achievable, actionable recommendations, as Karen said before, stuff that we can go do that can begin in 2021, but that actually have seismic impact, have the potential to do significant improvements in things that cut across sectors and cut across domains. Intentionally limiting that to a small handful. I think that we've all been involved with projects that have looked broadly across making change, and that's great. But there oftentimes are so many recommendations and so many things to do, it becomes somebody else's job. As Adam said earlier, the people in the room, the people on this call are people who can implement and who are connected and committed to doing that. And as we get into the process more, I hope that will become more clear and more obvious as we move forward in that work. So how we're doing this work. As you know, we've organized the work into 6 work groups that align with social determinants in general, how people are thinking about them. Obviously, there's an interaction between all of these, but we have organized them in these ways so that we can begin the work. And we've asked people to participate in the initial conversations around the areas that they're most, they have most interest, most experience, subject matter expertise, and are most interest and passion around that. Our intention, of course, is to not stay there, but to rapidly move across those domains. You'll also notice that one of the groups here is legal services, which is usually not as part of the social influences work that's out there. Earlier in the year or last year, we began to work some with Pew Charitable Trust and their view of the civil justice and the civil legal world as a social determinant, in their words. And so the more we talked about it, and obviously the more we look at the challenges facing us, the more we recognize the importance of that. So there is a separate group that is on legal and civil legal as a social influence. What we plan to do here is today, beginning work in these groups. We will apply some standard ways of thinking about them, assessing them, looking at what matters most from a priority perspective. We'll use some of the indicators that are available. Recently, Healthy People 2030 was just published. Wellbeing in the Nation is a tremendous resource with indicators and measures to be able to look at really what matters. Is there data? Is there evidence against these areas? And then on the way to our work, on the way we'll be gathering that information and then beginning that synthesis and integration process, which I spoke about before. So we'll start narrowly, and then over the next 2nd, 3rd, and 4th meetings and the work in between, we'll begin that integration process so that we'll go vertically and then horizontally. So we are able to identify those things that matter most for each of these categories and disciplines, but then what percolates up that affects most or all of these disciplines will be the goal if we can get there and when we get there. We have started thinking about a decision model for how do you evaluate these things, and recently came across a model from the Stanford Social Innovation Review that looks at a decision model. I use the word emergent here specifically because there are a lot of system thinkers on this call, and I'm not sure if the model, this particular model or others, are the best ones that we could use, but we want to engage people thinking about what would a theory of change look like? What would a decision model be looking like to accomplish what it is we're trying to get at? And so we offer that up as a way to think about it. And we have, not going into details here, a worksheet basically that we'll propose and we'll refine as we go forward. And an example of an actionable recommendation. This is one I just made up around changing federal funding streams, the policies to enable jurisdictions to blend and braid funding that can transform the use of information technology to conform to the needs of the community. I know many people are involved with that. And I know this has been a long-term issue that shows up in many reports. Is there something that we can do of this scale that would actually enable programs across the country and across every level? It's just an example. A little bit on logistics as we move forward here. We've scheduled, and you should all have on your calendars, a meeting in today, one in October, one in November, one in December. And then we have a virtual symposium scheduled for late January. We are hoping and planning to have what I'm calling intersession meetings between each of the work groups to dive more deeply into the work, reviewing materials, discussing, researching, distilling, and then preparing materials for your team and the broader team to review as we go forward. We originally planned an in-person meeting to do the distillation and synthesis. That was originally planned for January. A number of months ago, we made the determination that was not going to happen. So we pushed that out now to March. Hopefully people will be getting together then at that point in time, but we will stay agile around that. In terms of the meeting focus, in general, the first two meetings, today's meeting and the second meeting, is really a lot about group formation. It's looking at the social factors that people bring to the table, their knowledge of that, and an exploration of a complicated family, a scenario that you've all had a chance to look at, and we will be looking at more as we go forward in the conversation here. We'll transition as we come back into meeting 2 and then into meeting 3 and 4 with developing some of the action recommendations, both within your group, and then looking to synthesize those across the work groups. So we pivot starting in actually session 2 and into 3 and 4 to begin to identify, prioritize, and synthesize across that. And we do a final synthesis, hopefully, or a temporary or an interim synthesis for the January meeting, where we're able to sort of identify that. Today's work group process looks like the following. When we take a break, we'll return back to the Zoom room, and then we'll break you out into the groups, but everyone needs to come back here. We'll do some self-introductions and a discussion of your particular topic. We'll introduce the Thompson family. Many of you have seen the case study already, and hopefully have had a chance to read it. We'll start to capture some key ideas and questions. We'll ask you to start to plan an intersession work group meeting. How are we going to do that going forward? And then a short debrief to the whole group. We'll come back together in the last 15 minutes or so and just have an opportunity to share a few things that your group talked about or has been able to sort of identify as you've gone through this work. And then we'll adjourn for the day. And I'm just previewing this now, so when you get into your groups, you'll see this again, and your leads and your co-leads will help you walk through that. I want to show you just a few things that you're going to see when you come into your work group. You are all familiar with social determinants, and we're trying to use a different word. We're trying to think about it in terms of social influences as opposed to social determinants, given the heavy-handedness of the term determinants. But it's a term of art right now, but we recognize that it may not be, in fact, the best choice of words as we go forward in this. So you'll have a conversation around that. We have provided a definition for that particular social determinant, and we'll ask you to discuss that and after you've done your introductions, to get a feeling for who's in the room, how you're thinking about this, and importantly, to begin to hear each other's voices, where you come from, what you think about, how you, what drives your passion and your professional and your personal interests here. The second part is kind of an integrated approach. And what I'm showing you here is some work that has come out of a work group as part of the National Interoperability Collaborative, which is called the Proof of Concept. And the group of about 25 people who have been working now for quite a while have been thinking about how to create an actual working model that shows the interchange of information across systems in an open source, open standard way. And the group came up with this model in terms of putting the family, the community, the individual in the middle, and then being able to visualize who they're interacting with. This is not a complete picture of all, or maybe more services and supports than most people are receiving. But from a visual perspective, it helped the team and the engineers and the designers, the architects begin to think about where and who is addressing this family. What do they know and what do we need to know about that family? And so that's in many ways the foundational approach to an integrated whole person model that we're taking. You've all seen by now the Thompson family. And we offer this mural as a way, it's in many ways, it's a summary of the key points of that written case study. And we offer this for a couple of reasons. One is there are many people who are visual learners. There's a lot of detail in that scenario. That scenario is designed to do two things. One, it reflects the actual experience and the goals of some of the participants in this group that are involved with the Integrated Care for Kids program, the MOMS program, and other federal programs that are looking at creating integrated approaches to share information to take a whole person view. We'll have this mural up during your conversation so you can see the people, understand where and what and how they're involved, and in a way facilitate the conversation so that you have a visual of it. And for those of you who know our work, you'll know that we have oftentimes done graphics. I want to point your attention out to two things, and again, you'll hear more about this in your groups, but we've asked two questions here, and actually Dave Ross actually alluded to them earlier, which has to do with what do you need to know about and from your client? Who is Jameson? Who is Sarah? Who are the Thompsons? And what do we need to know from them? In addition to housing needs, service needs, programs, what are their goals? What are their aspirations? What are their community connectivity out here? We think that that's an important place to start to, again, norm the conversation so we understand that we start with a human voice and a human face in the middle of this. And then we'll ask you to guide your attention to what do we need to know from the system, and that's in air quotes. The system might be public services, might be community-based service, it might be informal services. The gap between those two things, the gap between what is the client situation? What are they looking at? Who are they? How are they interacting? Where are they interacting? With what's available and how we're treating them. That gap in the middle is really in many ways the best way to think about what we're doing here, is how do we connect those two things? How do we see the person in their family, in their community in total, and understand how best to support them from a strengths-based perspective as well as a responsible information sharing perspective? What can we do to affect the change in that at a significant level? And so that is the second part of that. That exercise will be to first look at the SDOH factor and then to look at the Thompson family. It's a complex case. We won't get through it all together. The last part of that, as I mentioned already, is the proof of concept. And this is being developed, this is way too much stuff to see on here, to parallel our efforts along the way so that what we're doing actually has implementation implications for communities who are actually trying to affect the change, who are trying to actually provide services, provide a whole person context with the technology support that's needed and the information, the communication that's needed in order to accomplish that. So when we talk about actionable recommendations, we're talking about not only policy things that may evolve, like blending and braiding funding streams and changing federal policies, or procurement or confidentiality or privacy or technology, or any of those kinds of things that will certainly pop up as important pieces. But we also, and that may be a process that takes a different trajectory of getting that done or working on that. Where we end up here is also being able to implement these ideas at the field level. So the practitioners and the community members are able to understand and to see and to actually take advantage of the ideas that are percolating up and through the group. So it goes from what I like to say from field to fed, and then fed back down to the field. Just a few more slides and we'll be done with the section here. The proof of concept, as I said, is based on the Integrated Care for Kids program out of the Center for Medicaid and Medicare Innovation. And their goal is to connect all these programs. It's a great program. It's well thought through. It's a significant challenge, but it represents a great opportunity to look at and to potentially support these initiatives and others across the community and across the country that are trying to connect these dots, so that every community doesn't need to create their own roadmap, their own blueprint, their own methods and models, but that the proof of concept and the work of this group can actually help them accomplish that more quickly. This is a resource that I hope many of you have seen. It's the National Interoperability Collaborative. On the collaborative site, which has well over 1,000 members at this point in time, there is a group for the National Action Agenda. And that group, as you drill through it, brings you to information that is relevant to what we're doing here and will be doing here. Think of it as in a sense, the meeting place, the virtual meeting place for the group as a total, so we can share ideas, have conversations, provide resources in a central virtual location. But it's also a place for each of the groups to participate and to have your own conversations. And you'll see up here in this grayed out section, each of the 6 work groups actually has their own mini site. And in that site is a section for discussions, for posting documentation, and for having conversations, and for providing logistical information. So we hope that this will be of value to you. It's designed in a way that it is asynchronous, so you can join at any time to use it and improve it and provide other information and other resources. And I see Laureen making some suggestions here about other resources and other kinds of information. That is exactly what we want to be able to bring to bear here, and to take the best thinking and the best ideas from other places and other organizations and to bring to bear on and in this particular organization. So we invite those resources, we invite your conversations, and there are already a few that have started. We think it could be a way to really help motivate and also provide the connectivity and the glue between the groups. This is the almost the last slide here, and then we'll open it up for a little bit of conversation. So what we're doing is not only ambitious, but it's also a challenge. It's hard enough to do work within your own organization, and when people are together, it's another thing to co-create virtually with a group of people that are disparate and are new to most people. So there's some ideas around this. Undoubtedly, the whole is greater than the sum of the parts. People on this call, the people in this room, have a tremendous amount of knowledge and wisdom that bringing that to the table will multiply the effects of that. There's a concept called self-managing or self-managing organizations. And that really means in many ways everyone is responsible for the outcomes. It requires you to take initiative. Don't ask for permission, over communicate. These groups are intended to be self-managing groups with support, with the context, with whatever kinds of resources we can provide. But the group themselves will be the success if we're able to do that. We encourage participation by everyone, and precept of everyone speaks once before someone speaks twice is a good one if that's possible to follow. Listening intently, inquiring, encouraging, volunteering, all good things to be doing. Humanize the virtual meetings. I know we're all tired of Zoom, but in situations like this, turning on your camera helps connect you to the people around and helps it put a face and a name together as we're part of this. If you're not part of the National Collaborative, please sign up. It's a good way for us to share information and for you to connect with the other partners in this. So what we'll be doing for the rest of the afternoon now is we will have a break coming up shortly. We would like you to come back at 2:25. So by 2:30, we'll break you into your group. So Michael and the team has taken all of your names and organized you into groups that you've identified. There may be a few people who are folks that may need to be assigned. We'll do that during the break. And if you're in the room, Michael will be there and auditing and monitoring that, so we can get you organized and part of a group as well. We will, as I said, when you come back, so the activities will be to come back to when you break into your groups, your facilitators will help you do a welcome exercise, an orientation, dive into the SDOH conversation. We'll introduce the Thompson family, have that conversation, ask you to come back to the group with just one or two things. We'll join together and then we'll adjourn till the next time. And as this progresses, we'll be learning from one another. So when we do leave, please leave your Zoom line open. If you get up to take a break, get coffee or whatever, you can leave it open and return to the same line here. So with that, we have a few minutes. I've seen a torrent of chat. I would love it if people wanted to say a few things, ask some questions, make statements. The floor is open for about 10 minutes here. And so welcome one, welcome all. Who would like to say something? You have to unmute yourself too. Or if you want to raise your hand or put a question in the chat, we can do that. We can do that as well. So maybe I'll start calling on people a little bit here. Actually, Lorraine, if you're on the phone, I know you mentioned something about the Bloomberg initiatives. Can you say a bit more about that? I know I've seen it over the years, but from a data source perspective.
Well, it is I was trying to find the link so I could put it in chat. So I'll try to do that as we go along here, but it's a great source for finding information on multi-sector efforts that are taking place around the country. I don't think it has systematically evaluated their impacts or anything like that, but some time ago, I had one of my master's students compile, and we're still doing it, a whole X-Mind concept map of all of the multi-sector efforts that we could find in the US, and basically what their models are for achieving change, what their primary focuses are, things like that. But it just occurred to me that we are so used to, as academics, going to PubMed and being able to pull out, systematic reviews of the effects of things, and that for multi-sector, interventions and partnerships, there's no one sort of source of truth that I can find that describes for us what, what has been attempted, what has been accomplished, what really works. So I wondered if you guys, because this is your bread and butter, knew about something like that.
The floor is open.
This is Richard Taylor with eTransX, and I want to share that single source of truth that we found very helpful. And Daniel, you mentioned that earlier about the well-being in the nation, the work that they have done to define the metrics for success. We think that's a very important starting point that we have found very helpful in the communities that we are working with.
Thank you for that. We have, yes, actually, one of the, in some of the slides, you'll see a link to them. If you're not familiar with them, they've done just a great job, and it's a fantastic collaboration. And some of the data sources there are easily available for access. I think as we look at the various social factors, we'll want to know, folks will want to know what some of the sources are, and they've done a great job compiling from a variety of different places a lot of really useful information and accessible information. Some of it is pre-pandemic, so it's not all the baselines. I think are questionable. In fact, one of the questions that we'll actually have to address is, what is the baseline now? Since from March everything kind of got blown up. So I'm wondering, especially from our academic and our practitioner community, how do we think about measurement going forward? It's what baseline do you use, and what is if there's a normal baseline, what should we be looking at, and how do we evaluate change going forward? It's an interesting question, I think.
Daniel, this is Cheryl Austin-Kasnoff, if I might.
Hi, Cheryl.
Hi. So I've been reading some of the chats, and I, like so many of you, have written papers on, oh my God, we can't change anything without changing the law. And one of the positive things I think that has come out of COVID is a recognition of two things. One is it's all local, and two, there are plenty of authorities to ideas. And so I would add to all of your charges, don't feel constrained by law in some way. Think about if you had the ability to try something new and demonstrate something new, what would it look like? Mm-hmm. And one of our recommendations may very well be to an authority that allows demonstrations of the kinds of things that we're going to talk about that are cross-sector. Certainly on the Medicaid side, and really in health in general, we have shown that anybody can do anything if it's waived. So I just wanted to add that to the conversation, because we've all been around too long to know that changing laws is really hard.
Yeah. Thank you, Cheryl, and we look forward to your guidance and other folks' guidance to make sure that we're thinking broadly and thinking, but also in ways that we think we can actually demonstrate change.
Daniel,
yes.
I just wanted to mention, I put a few different references in the chat. There's the Commonwealth Fund has a return on investment calculator for partnerships to address the social determinants of health. I put a link in the chat. One of the main, I guess, limitations is that for any of these kinds of tools, you have to ask, how are you measuring the benefit? Return on investment for whom? Or if you're just, are you only measuring, the impact on health? Or, and if in doing so, are you able to capture the benefits in the other domains of the person's life, right? So let's not, this is not meant as a critique of either the Commonwealth tool or anything, but I guess I'm just trying to just remind us that we need to the social determinants of health, that it doesn't become overly just clinically focused in terms of just looking at the health outcomes, but looking at the whole domain and the whole well-being of human beings. So
That's a great point, Matt. And I think one of the things we need to guard against is just that, is that medicalization of the SGOH factors. So many of them are in the social context. So again, we need to keep, we almost create some principles by which we remind each other about what we're trying to do here.
And just to add to that, this is Cheryl again, you may invest in one sector, but the returns are in another sector. I think.
exactly.
Right. Well, that's obviously one of the really challenging questions here is that whole wrong pockets problem that many people have been thinking about lately. And probably one of the downsides of siloed services are, if it doesn't benefit me, why should I invest in our budget if it's going to invest and help another domain? I think that may be one of the biggest problems that we face, and how we get beyond that. I know there's some innovative thoughts there. So,
Daniel, yeah, Dave, I just want to give an amen to what you just said.
Yes.
That is fundamentally, as we untangle and try to change things, let's just don't forget, we got to follow the money.
Yeah.
These systems behave the way they are funded to behave. And unless we change not only the funding, but the understanding of the rationale for why the money's spent the way it is, nothing's going to change. So you're on to the right thing, I think.
Yes. Yeah, I think so as well. And again, a lot of people on this call have been thinking about these same issues for a while. So let's build on that. So we are just 2 minutes after 2. So we're going to take a break here, get up, have a cup of coffee. And for those of you who are coming back, we look forward to seeing you promptly at 2:30, and we will dive into the work groups and get to it. So you can leave your cameras up, you can leave your connection open. And if you just turn off your sound or turn off your video, we will see you back here in about 20-25 minutes. Stretch, get a little exercise, get some oxygen, and we'll look forward to seeing you very soon. Okay, everybody.
Wow.
All right, welcome back, everybody. How are you all doing there?
Is everybody here? Daniel, all the groups are done?
We have, there are 70, I'm not 100% certain, but it looks like we have, do we have all of our liaisons? Grace, you're here. I see.
Alex here.
Gillian, Cecile, Daniel, Bach, are you here back? Okay, who else? Adam, you're back?
No.
Raise your hand if you're not here, Adam.
Christine?
Adam's under the sea.
I'm just trying to see if there's...
yeah, we're good. Our group is good.
Yeah, I think, I don't see Daniel Bach, though.
Should be back.
Should be.
Our group
There he is.
Oh, you're part of the group there, yeah. Okay.
Disbanded.
Wonderful, wonderful. Well, welcome back, everyone. The technology worked almost perfectly, and then our host Michael got kicked off, so I had to play host for a bit. His internet went nuts in Chicago, so lesson learned: make sure we have 2 backup hosts, not just 1. So, but otherwise, it looked like people were in groups. You had a chance to get acquainted. I would love to just spend a little bit of time. I know it's getting late on a Friday here. So I would love it if we could just go around the horn a little bit and hear just one thing from everybody, each group. Who would like to start?
I will start. Daniel.
Excellent.
So we had a lot of great points, so it was hard to
identify your group so everybody knows, because not everybody knows.
Oh, mine was on the legal side. So we talked a lot about the restructuring and the case being very overwhelming, and how to meet the family's needs. So we talked about meeting the client where they are. So really thinking about how to restructure, reevaluate the system, the processes, and the services to better serve. And an example on the legal side was online dispute resolution. That's technology to deliver legal, services in order to mitigate things like travel, and situations where, someone has to decide between being fired and default judgment. So that's just an example of just the overall system and trying to rethink how we deliver services to citizens and, and trying to meet them where they're at.
Thanks. Who do you want to hear from next? Which group? You get the benefit of going first is you get to choose the next group, but if you don't, I will.
Yeah, you go ahead.
Okay. How about the healthcare group?
We're going to have a tag team presentation here.
This is Cheryl, and then Elena will jump in. So we hit the ground running. Obviously, in healthcare, there are electronic records and personal health records and 50 other kinds of records. We really focused on the family and how do we empower the family to be the source of this information and really making it bi-directional. So not only would they gather all the information around their health and social determinants, they would define their family if they want to include grandparents, caretakers, whatever, and also that they would make the decisions about what information was in there. The other key, though, is what in the world do we do with all this information? And so we did spend a little bit of time on potentially even the need to create a whole new payment structure, and maybe even workforce would be in charge of really working from beginning to end with these families and assuring that they really are getting the comprehensive services. And we solved a few other problems, but I don't remember right now. So, and Elena ended by asking all kinds of questions. So let me turn it to Elena.
I just was hopeful to be able to, because the scope of our conversation was so broad, it is helpful for us to really think about what is the problem that we're trying to solve. I think Cheryl started off the conversation by saying, we're all interested in solutions. So it was very natural for, and many of the group, I do want to say the group is amazing in terms of its background and expertise. And so I'm really looking forward to working with everybody. But I think it's important to just step back and remind ourselves, what is it that we are trying to respond to?
Right. Thank you, Elena. Yeah, I think that's an important question to get really, focused on that and make sure we're clear on that. Great, thank you. How about the education folks?
Okay, I'll take that first. And actually, it links right in to what Elena was saying, because a lot of the interoperability is between the healthcare system and the education system. Although, particularly with the Thompson family, that suggests that we are focusing on the high needs kids. Or should we be focusing on all kids and not just high need kids, is an important question we should think about. And as we're looking at education and educational progress and attainment, what are the metrics? What indicators and what metrics should we be using to establish that? But as we're doing that and looking at this, the success of education, we need to ask two questions. What's going on with a particular family or a school district? And then the second question is, why is this happening? And so what's going on with the Thompson family and why is it happening? Which really brings up the issue of a lot of these issues we need to look upstream. And in education, upstream means early childhood, pre-K, even from the time of pregnancy and birth in some families with nurse home visitors. Upstream sometimes goes all the way to pregnancy and birth. And so all of this is linking multiple community-based organizations, the healthcare, the educational, the social welfare system, the legal system, as the educational system. And so much of this, as we look at the problem of a child or a family, we need to say, well, it is not just the problem with the child and the family, it's a problem with the system. The system failed the family and failed the child. And so what is it about the system that is not working? And I'll pass it off to Josh from there.
Yeah, so we looked very closely also at the idea of, accountability within the systems, and then really, holding the individuals that work in the system and the system itself accountable for the results. Looking at empowerment of the people that it's meant to serve, and with a specific defining empowerment as help as increasing the capacity of individuals and groups to make choices about what they want, about their futures, and transforming those choices into actions and outcomes. And in terms of upstream, we thought, looking at the drawing of the Thompson family, we really thought that Madison's picture should be bigger, and the fact that Jameson's got bigger than Madison's, almost because Jameson had more things happening because they snowballed over time. We can't let that happen. So Madison's picture, Madison, who was 3 years old, should have ended up just as big, because that's how you got to move things upstream.
That's an interesting observation. The visualization of that was is very clear now that you've stated that. It's interesting. And from our artist's perspective, interesting what draws the attention. The squeakiest wheel are the most problems.
Yeah, the older kid gets squeakier because more things have happened over time. And Don really hammered home the point about, you got to hit young.
Absolutely. Let's see, neighborhoods.
Can you hear me all right?
Yes.
Okay, well, first up, I have to thank the universe. This is the longest that I have been able to be on Zoom. I'm coming to you from rural northern Arizona, so I am incredibly grateful that I was able to stay on this long. And I'm very grateful for the group that we have. We have a very, very diverse and highly qualified group, spanning lived experience, every geography and organization. So that's wonderful. Looking at what we came up with initially in this sort of get to know you conversation, we recognized how critical it is that we focus on systemic and institutional racial and other inequities. And that while zip code is certainly a topic that we want to cover, it's not an umbrella topic. We want to look at access to broadband, access to quality education as issues that also are impacted by neighborhood and zip code. In terms of housing, typically we talk about affordability, but we need to expand that to talk about quality and accessibility as well. And in terms of the natural environment, we need to also consider ground, air, and water quality. Too often, vulnerable populations end up in locations where ground, air, and water quality are the poorest. We talked about how important it is to incorporate lived experience and sharing of power in the process of coming up with these recommendations and trying to think about best ways in order to do that. We talked about not focusing on just deficiencies, but also on assets and capabilities that encourage resiliency, taking a trauma-informed focus, and also looking at specifically at the Thompsons. There are too many wrong doors. There are too many places where the Thompsons have to go to get help and support, and the burden is on the Thompsons to knock on all those doors. What would happen if we saw funding for single connectors or funding for navigators? Right now, those are unfunded requirements. And talked about the provider burden, the burden on compliance. especially people getting funding for government housing, things of that sort. The burden is enormous, and the definitions are so precise as to require a tremendous amount of work. And then lastly, I thought a really good point was, why, rather than have these long upfront application processes, 15 pages, 20 pages, where we drill the Thompsons with all these different questions, what would happen if we started out by asking them, what do they want?
Right.
What do they need? What are their hopes? And again, moving to trying to get rid of the silos and look at cross functional navigators and coordinators.
Thank you. That sounds like you guys covered a lot of territory there.
Yeah.
Definitely a lot of territory. In being aware of the time here, what I'd like to do is just kind of move quickly through the next two groups and then just wrap. I hope everyone can spend a couple more minutes here. I know it's late there. So who's up next?
Chris?
Daniel, this is Christine. I can jump in. Oops, jumped ahead of Grace. Do you want me to just go ahead?
Sure,
Go for it.
Please.
Oh, okay. So for the community group, I just want to comment on the definition and then ask David if he'll comment on the group's discussion about the Thompsons. So we actually did a fair amount of talk about our definition, and particularly in light of the well-being in the nation, two of their domains, the one around belonging and the second around civic muscle, and decided that we wanted our definition to come with a couple of footnotes, one to that and the second to Healthy People 2030 and its definition of civic engagement that is present in Healthy People. Our group really was decided to also shy away a little bit from the financial piece and wanted to replace that example in the definition with social isolation instead. And it almost makes me wonder if we need another group that's sort of looking at labor and all of that, because I'm not sure that that's covered. And we certainly really didn't go down that route particularly. So again, but overall, people were very, very pleased with the definition. Wanted to make a couple of tweaks and a couple of references so that we really got this concept of looking at the whole person. And then the last thing I wanted to mention is, of course, this group really is by definition upstream, and it was very hard to hold ourselves upstream and not to try to do the sort of problem solving for the things occurring to the Thompson family. But David, if you want to comment briefly on the discussion of the Thompson family.
Yeah, no, thank you, Christine. And that covered it nicely. And I think there were a variety of things we wanted to fill in, and felt like we could sort of answer some questions about why the things happened and speculate at those and sort of bring our own ideas to that, kind of like how some of the other groups have talked about. So it was a bit more of a challenge in some ways when we thought about some of the structural things like education or poverty reduction and how to think of these social interactions. I think the other thing that, echoing some of the other groups is like, what would be the things that they would want right now? And then what we could think about, was sort of causing those things. When we think about like the importance of civic participation, for example, that's probably not going to be like first on their list of like, I need to vote, or it's important right now, and, dealing with the things that are right in front of them. So making sure there's that balance there of really responding to what their needs are, as well as thinking about those long-term needs going forward.
Great. Thank you. I think economic mobility. So.
Yep, we're the last one. So we'll be quick. We had a fantastic group and a fantastic discussion. And we first discussed, what are the services and needs of the family, and obviously it's many, child protective services involved, everything, food, housing, everything. But then we talked about and then the conversation kind of went to how do we make these services work better for people. And that's important. We talked about one of the problems. You could see 10 different organizations, government organizations working with this family, and none of them talking to each other. And so people tend to beat up the medical model as being, not the right way, but the public health and social model is just as siloed. And here's a perfect example of it. And then we talked about sort of a super, what was the word, Bill? I can't remember. Like a super person that.
Super case manager.
Yeah, there you go. Super case manager that would help with all that. And all of that is great. But then we pushed ourselves like, wait a minute, the conversation now is all about the programs and the government and how to make the government work better. And we're not talking about the people anymore. Or the patients or anything. So we changed it around and said, well, what's the one or two things that need to happen in this family to just one or two that would substantially improve their economic mobility. That led to a fascinating discussion. I can't go into all of them, but it was a wide ranging of things, recognizing the difficulty. But I think at the end of the day, our educational system needs to be revamped. And if you lumped it all down, we talked about really, at the end of the day, no matter what services we're giving, if we're not helping people have hope for the future, and then providing them either a pathway or real opportunity for improvement, it's going to be hard to see any change.
Absolutely. Well, thank you. I know that breakouts and the sort of reporting in only gets sort of a very thin slice of the rich discussion that I know that you guys have had during the last couple of hours there. So I'm really appreciative of the time and effort and the participation you've all made. I think next steps now, I think your teams probably talked a little bit about sort of in between the sessions, trying to right? And sort of trying to focus, sort of summarize and then focus and then prepare for the next conversation as we move from sort of formation and ideation and getting to know each other into some specific recommendations, starting to move towards, outlining the key issues and the key opportunities that would move that forward. I love the idea that you said before about, you think about prevention and education, it really does bring you back down and upstream. It does bring you down to early care and education, home visiting, prenatal. That's a real obvious place. If we're focused on upstream and prevention, which I think we are, it will be a wonderful place to go. So our team will try to summarize sort of the key ideas here, and we'll push that back out to the groups. We're looking forward to sort of refining those, bringing them back together in the next session on the 16th. I know I've heard some requests and asks for clearer definition around the goal and what does success look like and how are we going to measure that, so to speak. And so our obligation back to you is to spend a little more time sort of defining that and what that process would look like and what does success look like for us. Because we obviously can't boil the whole ocean, but there are certainly a lot of things, even just based on this quick debrief, that seem to be really promising in terms of opportunities for us. So.
This is Cheryl. I would ask, it seems like some of the groups said similar things. We may have said it differently. Mm-hmm. One thing that would be really helpful is what were the 3 or 4 really key items that kind of emerged here?
Yeah.
I think for all the groups to know that, again, they may have been worded differently, but I'm just thinking about like the super caseworker. We sort of had the same thing, yeah. All of that. I think that's how consensus begins to emerge, is we all thought of the same thing.
Yeah.
So I would just ask that.
Yeah, I just drew a little matrix to sort of start to organize that. We can take the first whack at that to see to the groups and are there common themes that sort of fit together that way as at least as a starting point, and that's a great recommendation. Other ideas around that are certainly welcome. I encourage you to go to the hub, put your ideas, ask your questions. We'll be posting some of the resources, and I believe next week we'll get back to you with at least a first draft or first cut on what that summary looks like and some more specific direction about what next steps are. Thank you so much for your time and attention. It's been a great day. It's always great to see on the other side of the planning, that you're here and sticking together and thinking hard together is wonderful. I'm encouraged, excited, and delighted. I hope you are. I hope you feel like it was worth the time. And start the conversations. If you don't wait, in discussion groups, there's great places to add those thoughts and sort of fill them out a bit. So with that, everybody, have a wonderful weekend. Be well. Thank you so much for your time again. And we really look forward to catching up with you again real soon.
All right. Thank you.
Thank you.
Thanks, everybody. Thank you. Have a good weekend.